Hello students, in the previous class we have discussed the amniocentesis, okay, and also we have discussed the infertility. In the amniocentesis we have discussed what is amniocentesis, why it is required, or the what is the need of the amniocentesis. Also we have discussed the misuse of the amniocentesis. Then we have discussed the various two types of amniocentesis. One is your genetic, other one is your maturity. Then we have discussed the infertility in detail, and we have discussed in detail the infertility in women. Today we will discuss the infertility in men. Okay, we will start from the cause of the infertility in men. So first point, the main cause behind the infertility in men is your abnormality of the semen, or we can say abnormal semen is the main reason behind the 75% cases of the infertility in men. So we will write this. Abnormal semen is the main reason behind the 75% of cases, 75% cases of 75% cases of infertile men. We will write the infertile men. Cases of infertile men. Okay, means if the region is somehow various regions are there, but 75 cases in case of the infertile men, the main reason is your abnormal semen. Okay, so what are the reasons behind the abnormal semen? So the abnormal semen can be due to following reasons. Abnormal semen can be due to followings. Okay, first one is your the low sperm count or oligospermia, which you know already. Oligospermia, or we can simply write low sperm count. Okay, means we know in general the 1 ml of semen consists of around 20 million of sperm, or greater or more than that, then that the person or the male is fertile. If the person is having less than 10 million sperm in per 1 ml of semen, then in that case the male is infertile. Means less than 10 million sperm per ml of semen, which leads to infertility. Okay. Second one, it will lead to second point is your the decrease in the sperm motility. We can say low sperm motility. Okay, means just a second, ink is flowing. Second point is your low sperm motility. Means we know the main characteristics of the sperm is its motile nature or highly motile nature. Due to its low sperm motility, its swimming nature gets affected. Okay, by which it does not effective in the swimming, or we can say it cannot reach up to the ova, so that it cannot fuse or it cannot fertilize. Okay, so we can say decrease in sperm motility affect the nature of sperm and can't swim properly as it should be. That I am not writing, as it should be. Okay, third point is your no sperm, or we can say azoospermia. No sperm, or we can say azoospermia. Means what? Obviously, if the sperm is present, then only it will fuse with the or fertilize with the ova. If there is no sperm, then there is no fertilization, eventually leads to the infertility. So we can say semen consists of no sperm. Okay. So last one is your abnormal sperm. Last point is your abnormal sperm. Okay. As we know, the sperm has a definite structure, definite shape by which it is able to fertilize the egg or the ova. But due to some reasons, the structure of the sperm gets changed, or we can say it becomes abnormal, by which it does not reach up to the ova and it cannot fertilize it. Okay, we can say in some cases the shape and structure of sperm becomes abnormal, which makes it unable to fertilize, which makes it unable to reach to the ova and to fertilize it, which makes it unable to reach the ova and fertilize it. Okay, as the normal sperm structure is means is changed due to various reasons. Okay, there are so many reasons. For example, it should be means the head is bifurcated, or we can say the tail structure is not proper. If for in some cases the tail is being bifurcated, or in some cases the sperm head becomes some different structure like shape. So due to various reasons, due to the change of the shape of the sperm, which becomes abnormal, it becomes unable to reach up to the ova. Or we can say eventually as it can't reach up to the ova, it also it becomes unable to fertilize the ova. Okay, so these are your 4 reasons. First one is your oligospermia, means low sperm count. If the sperm count is very low, below 10 million, then the person or the male is infertile. Low sperm motility, if the sperm becomes which nature is highly motile, it's become low or the motility decreases, then also it is unable to fertilize, or we can say it leads to the infertility. No sperm or azoospermia, if the semen completely absent, or if the semen does not have any sperm, then obviously it can't fuse or it can't fertilize the ova. And the last one is your abnormal sperm, means the structure of the sperm becomes abnormal, by which also it can't reach the ova and also it can't fertilize the ova or the egg. Okay, please note down. We have discussed the various why the abnormal semen causes the various reasons we have discussed due to the various oligospermia, or 4 reasons we have discussed, and also we have discussed due to the abnormal sperm, the sperm cannot reach the ova, or we can say it is becomes more difficult as the structure changes. It becomes more difficult for the sperm to reach up to the ova, and eventually it does not fertilize it. It can't fertilize it. Now we'll discuss clear reasons behind the abnormal semen. Okay. First one is your testicular infection. Okay, testicular means it involves both testis and the epididymis. If some infection is present in the testicular region, it means it in the testis or the epididymis region, it also may lead to the abnormal semen. Okay. Next is your testicular cancer. Okay. If cancer arises in the testicular region such as your testis or epididymis, it also lead to your abnormal semen. Next is your testicular surgery. If some surgery is being done in the testicular region, that is your testis and the epididymis region, then it also may lead or harm to your semen, by which it can the main reason it can be the main reason behind your abnormal semen. Next is your overeating testicles. Means we know the testes, the scrotum requires 2 to 3 centigrade temperature lower than the normal body temperature. That is why it is extra abdominal in region. But in some cases, if overheating causes, means common example I will give, if we are working so many hours, for hours by keeping the laptop on our lap, then eventually, as we know, the ground portion of the laptop causes heat or emit heat, and that heat is being absorbed by our lap, by our testes or the epididymis region. So that also causes the abnormal semen. Or we can also say another good example, it is always advised to keep your mobile always in the back pocket, not in your front pocket, because the normal heat or the radiation which also affect the temperature of the semen, which also helps in, which also cause the main reason behind the damage or the abnormality of the semen. So eventually your fourth reason is your overheating of the testicles, okay, which will eventually lead to the abnormal semen. Next is your ejaculation disorder. Means if the ejaculation is not efficient, okay, so that it can properly fertilize the egg, then that also we can say in that case also it is the main reason behind the abnormal semen. Okay. Next is your undescendant testicle. As we know, as you know already, the cryptorchidism or the cryptorchism. Means if the testis is not descendant down into the scrotal sac, then that condition is known as your cryptorchism or cryptorchidism. Okay. In that case also it is the main reason behind the abnormal semen. Next, your genetic abnormalities. Obviously, if some genetic problem is there in the family history, then it may also lead to the abnormal semen. Next is your mumps. Means if some swelling or pain occurs in the testicular region or the testis or the epididymis region, it is also main reason behind the abnormal semen. Next is your radiotherapy. For example, if a person is being treated before by the radiotherapy, means some radiation is being given, and if the radiation is being given prior or closer to the reproductive part or to the testis or the epididymis, then it may also affect or it may also damage some portion of the testis or the epididymis, which eventually leads to the abnormal semen. Okay. Last one, disease like diabetes, thyroid malfunction or anemia, these also may lead to the abnormal semen. So there are your various reasons. First one is your testicular infection, testicular cancer. Third one is testicular surgery, overeating of the testicles, ejaculation disorder, undescendant testicles such as your cryptorchism, then your genetic abnormalities, next your mumps, radiotherapy, and the various diseases like anemia, diabetes, and your thyroid malfunction. Means thyroid is not properly functioning. In that case also it may lead to the abnormal semen. Okay, please note down. Next we will discuss the various diagnoses or the various tests in case of the fertility in case of both male and female. First one we will discuss the test, then we will discuss the test of the male, and then we will discuss the female. First one in case of test of the male is your general routine, that is your general physical examination. Means in general there are some routine checkup by which the general physical tests are being done to check the infertility of the male. So this one is your first, that is a general physical examination. Second is a semen analysis, means some portion of the ejaculated semen is being taken, and from that semen it is calculated that how many amount of sperm is present per ml of semen. As we know, if the sperm count is below 10, then that is a low sperm count or oligospermia, which may leads to infertility. If it is above 10, or normally if it is above 20 million sperm per 1 ml of semen, then it is normal or fertile. Next is your simply some blood test or blood analysis, from which we can also detect the infertility. Next is your obviously the ultrasound test. By the help of ultrasound test, we can detect and if there is any problem in the male reproductive tract, which can eventually give us information about the infertility. Okay. And last one is your chlamydia test. Means chlamydia means it is a bacteria. Okay, which is this test is generally taken by the urine test. By the help of urine test, we can know about the chlamydia, if the bacteria is present or not. If the chlamydia is present, it can generally infect the male reproductive tract, which will eventually lead to the infertility. Okay, so the various tests of the males are: first one is your general physical examination, second one is your semen analysis, third one is your blood analysis, fourth one is your ultrasound test, by which you can detect or check the male reproductive tract, and last one is your chlamydia test, or by the help of which is done by the urine test. Next we will discuss the test of females. The first point is also same as we do the various routine checkup or the checkup of the physical examination. So first one is same, general physical examination. Okay. Second one is the same as the male test, that is your blood test. Okay. By the help of the blood test also we can check the infertility of the female. Third one is your hysteroscalpyngography, by which this is the technique, this is the test, hysteroscalpyngography, by which we can know that there is a normal shape of the uterus or the fallopian tube. If there is a somehow changes in structure and shape of the uterus and fallopian tube, then obviously it will create an unsuitable environment, which will eventually leads to the infertility in case of the female. So please note down the hysteroscalpyngography test. Okay. Next one is your obviously pelvic ultrasound, by which we can know or detect what is the situation of the uterus or the pelvic portion. Next is your thyroid functioning test. If your thyroid is functioning properly or not, by which test we can know that is by the thyroid function test. So by these all tests we can know whether the female is fertile or infertile. First one is your general physical examination, second one is your blood test, third one is your hysteroscalpyngography test, then is your pelvic ultrasound, last one is your thyroid function test. Okay, so by the help of these diagnosis or these tests of the male and female, we can know whether the male or female is fertile or infertile. Okay, please note down. Now we'll discuss various treatment of the infertility. Okay, now so far we have discussed the diagnosis or the test. Now we'll discuss the treatment. We'll discuss in the case of male, also we'll discuss in the case of the female. First one is the treatment for the erectile dysfunction. Erectile dysfunctioning means during the sexual intercourse it is very neat that the penis should be erect, but in some cases of the male, due to some problems, the erectness of the penis is become dysfunctional, or the penis can't become erect during the sexual intercourse. So by the treatment of this erectile dysfunctioning by taking various medicines, it also can be eventually lead to the fertility treatments of the male. Okay. Next, the treatment for blockage of the ejaculatory duct. Okay, if the ejaculatory duct is somehow due to various reasons it is blocked and the passage of the semen is being blocked, so by the help of various treatment also the passage can be opened or free, by the which the semen can easily flow. So by the treatment of the blockage of the ejaculatory duct also, it can lead to the various fertility treatment of the male. Next is your treatment for retrograde ejaculation. What is retrograde ejaculation? If the ejaculation means, we can say the sperm enters into during the ejaculation enters into the bladder in spite of entering into the penis. that is what I am written C. Treatment for retrograde ejaculation means what? When semen enters into the bladder instead of emerging through the penis. We know that before ejaculation the semen enters into the penis, but if it enters into the bladder instead of penis, then that condition is known as a retrograde ejaculation, and that by treating that retrograde ejaculation we can also eventually help in the treatment of the fertility of the male. Last one is surgery for epididymal blockage. If due to some reason the epididymal region is also blocked, so we can free that region by doing the various treatment. Okay, so these are your first fertility treatment of the males. First one is your treatment for the erectile dysfunctioning. Second one is your treatment for the blockage of the ejaculatory duct. Third one is your treatment for the retrograde ejaculation. Okay, means the semen enters into the bladder instead of entering into the penis. Fourth one is your surgery for the epididymal blockage, by which the epididymal blockage will be opened and the passage will be free. Next we will discuss the fertility treatment of the female. There are three treatments. First one is the treatment of the ovulation disorder. Means if the ovulation disorder is present, by which the ovulation does not occur properly. So by the help of taking various medicines or by the various treatments, the ovulation disorder can be made okay, or we can say it can be treated. So by the treatment of the ovulation disorder, it can eventually lead to the treatment for the infertility. Next is a surgery of the fallopian tube. Means what? We know the fallopian tube, which is the, we can say the fertilization site, that is particular, we can say the ampulla isthmic junction is that fertilization site of the female. So if there is some problem in the fallopian tube, and we can repair that, or we can do treatment of that by various treatment or surgery, then it can also lead, or we can say it can also lead to the treatment of the fertility of the female. Last one is a laparoscopic surgery. This one is basically done in the case of the zygote intrafallopian transfer. We'll read in detail, by which the female which is not able to conceive, or we can say it is able to grow up the baby, by the help of the laparoscopic surgery, the female can have a child. Okay, so becoming from the infertile, she can also have a baby. So there are three reasons behind the fertility treatment for the females, by which the infertile females can also become the fertile by the help of the treatment for the ovulation disorder, surgery of the fallopian tube, and last one is a laparoscopic surgery. Okay, so these are your fertility treatments for the both male and female, by which they can be converted from the, or we can say they can treated, or they can be cured from the infertility to the fertility. Okay, or we can say they can be converted from sterile to fertile. Okay, please note down. Now come to the assisted reproductive technology. In this our the modern advanced form of the medical, we can in our environment in where there are a lot of infertility, assisted reproductive technology is like a boon for the infertile couple, by which by using various special techniques they can have a baby. Okay, as our medical technology is now very improved, by which we can have a baby, or the infertile couple can have a baby by using the assisted reproductive technology, or ART. Okay, so we can say ART is a group of special technique in which the reproduction of the infertile couples, okay, in which the reproduction of the infertile couples takes place by retrieving the oocyte from the egg, oocyte from the ovary, and the sperm from the testis. Okay, we can write here the ART, or the assisted reproductive technology. ART is a group of special techniques which helps in reproduction of infertile couples infertile couples by retrieving oocyte from ovary, obviously from ovary, and or we can say or sperm from the testis, okay. And this technique is like a boon for the infertile couple, by which before so many years back it was not possible, but due to the advanced medical technology, nowadays it is possible, or we can say it is a boon for the infertile couple, by which they can have their own baby, but in the advanced form, okay. So it is a group of special technique which helps in reproduction of the infertile couples by retrieving or taking out of the eggs from the ovary or sperm from the testis. It is of 6 types, okay. The ART is of 6 types. First one is your IVF or in vitro fertilization. In vitro fertilization, okay, means IVF also we can write. In detail we'll discuss, don't worry. Next one is your artificial insemination technique. Artificial insemination technique, which is also written as AIT. AIT, okay. Next is your gamete intrafallopian transfer and zygote intrafallopian transfer. Gamete intrafallopian transfer, okay, which is can also be written as GIFT. GIFT, okay. Whereas the fourth one is your simply zygote. Zygote intrafallopian transfer. It can also be written as ZIFT, okay. Next is your intracytoplasmic sperm injection. Intracytoplasmic sperm injection, and this can also be written as ICSI. ICSI, okay. Last one is your surrogate mother. As of now, you just note down the points. In detail, we'll discuss now. Okay, please note down. Okay, please note down. So first we'll discuss the in vitro fertilization. As the name suggests, in vitro means outside of the body fertilization takes place. Obviously in vitro means outside the body. Next, fertilization means fusion of the male gamete and the female gamete. This technique was first devised by Patrick Steptoe and Robert Edward in the year 1978. Patrick Steptoe and Robert Edward in the year 1978. It was first devised. Obviously, in this method, gametes are fertilized outside the body. As I have told earlier that the gametes are fertilized outside the body, followed by the embryo transfer. When the zygote is being formed, it is then transferred into the uterus or the mother's womb. Okay, in vivo, okay, means as if the embryo transfer in vivo followed by the embryo transfer means, as in case of the in vivo, means inside the body as the fertilization takes place, in the zygote formation takes place, that is in that manner also in a laboratory. The in vitro means outside the body the fusion of the male gamete and the female gamete takes place. After the embryo is formed, after the zygote is formed up to the 8 blastomere stage we will discuss now, then it is transferred into the mother's womb. last one is ova from the wife or the donor female takes place. If the wife is eligible, if the ova is of standard type, then from the wife is taken, or it can also be taken from the donor female. Or the sperm, if the sperm of the husband is eligible, then it is taken from the sperm, or if he is not eligible for the fertile, then the sperm can be taken from the donor male or the sperm bank, okay, by which it is induced to form zygote in the laboratory in the manner of in vitro. Then it is transferred, or the embryo is being transferred into the mother's womb. Okay, so these are some points of the in vitro fertilization. Okay, please note down. So now some more points of the in vitro fertilization. When the embryo, means after the zygote formation, the embryo is being cultured. When the embryo becomes 8 cell, we can say 8 cell blastoma stage, it is transferred into the fallopian tube when till further development takes place. Next, the embryo is then implanted in the uterus, where the embryo becomes the fully fetus. Okay, so now 1 mark objective will come. The first successful test tube baby was in the year July 1978, and its name is Louis Brown. Okay, so 1 mark objective can come. What is the first test tube baby and in which year? Louis Brown, in the year July 1978. But if it is asked the first test tube baby in India, then it was done by Subhas Mukherjee in the same year, but month of October 1978, and the Subhas Mukherjee done the IVF, resulting in a test tube. The name of the baby was Durga, or another name is your Kanupriya Agarwal. So 1 mark objective can come. The first test tube baby is your Louis Brown, okay, in the month of July in the year 1978. If it is asked in the case of the India, the first test tube, then your answer will be the IVF was done by Subhas Mukherjee, and the name of the test tube baby of the India, first test tube baby of India, was your Durga or Kanupriya Agarwal. Okay, please note down. I am giving 2 seconds of pause. Note down all the points. Now come to the various steps of the in vitro fertilization. Step 1 is your super ovulation. Means we know during the ovulation 1 egg releases, but by applying various medicine or the fertility drugs to the woman which boost the ovulation, by which more number of the egg will be formed, and by collecting that, the best egg will take for the fusion. Okay. Second one is your egg retrieval. Means by the help of your minor surgery, that is called your follicular aspiration, the egg is being removed from the woman's body, which is your second step, that is your egg retrieval. Third is your insemination and fertilization. Insemination means what? Exposure of the sperm or the semen into the vagina. So exactly that, like the main semen is being collected, the best man from the husband or the donor is being collected, okay, and the egg is also being retrieved. And also that is in vitro fertilization takes place in a suitable condition. Means in vivo, means inside the body the favorable condition is as like it is given inside the laboratory to make it fuse, or we can say the male gamete and female gamete fuses to form a zygote. In vitro means inside the laboratory, outside the body. Okay, so the main semen placed together with the best quality egg, the mixing of the sperm egg is called, and egg is called insemination. As I told, the mixing of the sperm and egg is called the insemination. Next is your step 4, that is your embryo culture. Now the fertilization is being done. After the fertilization, the zygote goes on after the cleavage step, by which it will form the 8-celled blastomere stage. Okay, so this stage is your called embryo culture. Following the fertilization, the zygote undergoes cleavage and turns into an embryo, and that embryo should be up to 8 cell stage or 8 blastomere stage. Only that after that the 5th number stage is done, by which that 8 cell stage or the embryo is being introduced or injected into the woman's womb, by which it is normally developed into a fetus. So your step 5 is your embryo transfer or ET. The embryo are placed into the woman's womb, okay, and that is done after the 3 to 5 days of the egg retrieval, okay, 3 to 5 days after the egg retrieval and the fertilization. Okay, so these are your 5 steps. First one is your superovulation, second one is your egg retrieval, third one is your insemination and fertilization, fourth one is your embryo culture, and fifth one is your embryo transfer. Now we'll do the by the help of the diagram, we'll completely understand. You will have a complete idea about the steps of the in vitro fertilization. First you note all the points, then I will discuss by using the diagram. Please note the points. So far now we have discussed the various steps involved under the in vitro fertilization. So now we will try to understand the various steps under the in vitro fertilization by the diagram. So obviously your first step, you know, that is the stimulation by the help of the stimulation to produce the superovulation. So you can see here. So you can see here, the first step is your ovarian stimulation hormone therapy. Means some hormone is being given so that the superovulation continues. Superovulation means the formation of more than one egg, so that we can select the better quality of the egg for the fertilization. So your first step is your ovarian stimulation, means artificially will provide hormone for the superovulation. Okay. Second step. During the superovulation, the egg is being retrieved. Okay, the egg is being retrieved by particular surgery, or we can say by a hollow needle by the means of the vacuum pump. You can see here, second step, egg pickup or the aspiration. Okay, it is a surgical method, and the whole technique is being controlled by the ultrasound. Okay, to know the statistics, or we can know the situation of the complete uterus. Next step is your third number step, that is your sperm preparation. Means the sperm can be collected from the father, or we can also collect the sperm from the donor if the father is incapable for the fertilization. Means the sperm of the father is if incapable, then we can collect the sperm from the sperm donor, or we can say semen bank or sperm bank. So this one is your third step. You can see that the sperm is being collected. Okay, healthy sperm is being collected, and here the healthy egg or ova are being collected. Fourth step is your fusion, means or fertilization and the insemination. In the fourth step, okay, the quality sperm will fuse with the quality egg. Okay, this is the insemination and the fertilization technique. Fourth one step. Okay, fifth one is your embryo culture or embryo development. Means one healthy sperm will fuse with one healthy egg, by which it will carry on by the various cleavage process up to until your fusion, the fertilization zygote will form the 1 cell stage, 2 cell stage, 4 cell stage, lastly your 8 blastomere stage. Okay, when the 8 blastomere stage will be formed, then it will be injected into the uterus by the technique called embryo transfer or ET. Okay, embryo transfer or ET. Okay, then further the growth of the embryo takes place. Eventually the baby is born after the gestation period. Okay, but the embryo transfer is done after the fertilization, means egg fertilization or the insemination or the egg retrieval and the fertilization. After 3 to 4 days or generally 4 to 5 days, the embryo is being transferred into the mother's uterus, where the baby can be grown. Okay, so this is all about your overall all the steps that we have discussed earlier also, but I am now describing as by the manner of the diagram. Okay, first step is your ovarian stimulation hormone therapy, by which the superovulation occurs. Second one, the retrieving of the egg or egg pickup or the surgery that is known as aspiration. Third one is your sperm preparation, means healthy sperm is collected. Fourth one, insemination and egg fertilization. Next, your egg will go through the cleavage process, which is known as your embryo culture or the embryonic development. by which it will form the 2 cell, 4 cell, 8 cell or 8 blastomer cell stage. When it will becomes the 8 blastomer cell stage, it will be injected into the mother's womb or uterus where it can normally grow. Okay, so this is all about your diagrams involved in the IVF or in vitro fertilization or steps involved in the in vitro fertilization. Please have a screenshot of the diagram. Okay, I am giving a pause. Please give a have a screenshot. Okay, note down. Now come to the advantages and disadvantages of the IVF. Obviously, by the help of IVF, if a lady cannot have a baby, so she can have a baby by the help of the IVF and she can become pregnant. Second, if in case of female, the fallopian tube is damaged or blocked, or we can say if the endometriosis is caused, means the cells of the uterus which are found in the uterus are grown in some elsewhere of part of the female. So in that case also, which causes the infertility, in that case also the female can go for the IVF or the in vitro fertilization. Next, in the case of male, if the low sperm count or the blockage in the ejaculatory duct causes, then the male can also go for the IVF or the in vitro fertilization. And last point is the unexplained infertility, means due to various reasons which can be unexplained or unknown reasons, it can also lead to the infertility. But due to all these reasons also, they can, in spite of these reasons, they can go for the IVF or the in vitro fertilization. So these are your advantages. Disadvantages are what? It is very expensive. It takes more money and lot of time. Okay. A woman who is taking fertility medicine or drugs obviously for the superovulation can have various side effects, okay, such as your headache, bloating, means having gas in the stomach, in the bloating, or the abdominal pain also she can feel also more amount of abdominal pain, headache, and also various amount of types of side effects. Okay. Next, the risk of the egg retrieval. There are also various risks during the egg retrieval. What are the risks? It can include while anesthesia, obviously anesthesia is being given, which can also lead while during the retrievation of the egg, it can lead to excessive bleeding or the infection and damage to the structure surrounding the ovary. Okay, bleeding can also occur or damage also can occur with the structure surrounding the ovary, or infection may also occur, which are the main risk behind the egg retrieval. So these are your main disadvantages in the case of the IVF, and these are your advantages in case of the IVF or in vitro fertilization. Okay, please note down the points. Now we will discuss our next technique or second technique, that is your artificial insemination technique or AIT. Okay, first point, in this method the intrauterine insemination is common. Insemination means we can say the expose of the sperm into the vagina. So in this case the sperm or of the donor, or we can basically from the donor only, because in this case the female is normal, but basically in most of the cases the female is normal, but the male have the fault. So that is why the sperm or the semen sperm is being exposed or inseminated into the uterus. That is why it is called the intrauterine insemination. So the first part, in this method the intrauterine insemination is very common. Okay. Second point, just near the time of the ovulation, when the egg will be released, at that time around 0.3 ml of washed sperm, means healthy sperm. Okay, washed sperm or healthy sperm are separated, and concentrated semen having at least 1 million sperm. Okay, at least 1 million sperm from the husband is introduced artificially, okay, into the vagina or the intrauterus, called the intrauterine insemination. Okay. Next is your best results are obtained when the motile sperm count is more than 10 million. Obviously we know if the sperm count is above 10 million, then only it can give a better results. So for the better results, the motile sperm count should be more than 10 million. Okay. Next point, the fertilizing capacity of the sperm is for 24 to 28 hours. As we know, the viability of the sperm is about 24 to 28 hours. That is why it should be inserted for continuous for the 2 to 3 times in the 2 to 3 days. That is why the success result is about 20 to 40%. As the fertilizing capacity is for 24 to 28 hours, that is why it is the procedure of the inserting of the sperm, it is repeated, the insemination is being repeated 2 to 3 times in the 2 to 3 days, and the success ratio is around 20 to 40 days. When husband sperms are defective, basically, as I have said earlier, in the most cases, if the husbands are more default in this case, if the husband sperm is defective, then the sperm is being taken from the AIT donor. Okay, or we can say sperm donor is being used, and in this case generally the semen is being taken from the semen bank, or the healthy semen that is stored, or the sperm donor, one donor which who donates his sperm for this AIT technique is being used mostly. Okay, so these are your general points under the artificial insemination. Please note down. Achha, one point, the sperm, or we can say the sperm from the husband is artificially inserted into the vagina through, you please underline this, through a flexible polyethylene catheter. Okay, by the help of how the sperm is being introduced artificially introduced into the vagina, by the help of note down the point, flexible polyethylene catheter into the vagina, or we can say intrauterus, called the intrauterine insemination, by which it is being introduced, by the help of flexible polyethylene catheter. Okay, please note down the points. Now we will discuss our two more ART techniques, that is your gamete intrafallopian transfer and similar to that zygote intrafallopian transfer. As the name suggests, gamete intrafallopian transfer means gamete, intra means within, fallopian transfer means gametes are being introduced into the fallopian transfer. So first point, this method was first introduced by Ask and the colleagues in the year 1984. Okay, in this method, as I have said, the gametes are being introduced, means the both sperms and the unfertilized oocyte are transferred into the fallopian tube. Okay, as I have said earlier, then the fertilization obviously takes place inside the body of the female. Okay, and this method is used in the female who cannot produce ova or egg but can provide suitable environment for fertilization and for the development of the embryo. Okay, this technique is used in case of the female who could not produce the ova or the egg but can provide a suitable environment for fertilization and the embryo development. That is why the gametes are being transferred into the fallopian tube, the sperm and the ova both. Okay, in this method, sperms and unfertilized oocyte are transferred into the fallopian tube. Okay, so this is known as a GIFT or the gamete intrafallopian transfer. Accordingly, your next technique is zygote intrafallopian transfer, means the zygote or the fertilized zygote is being introduced into the fallopian tube, such as see. The process is exactly similar to the GIFT, but the difference is that here the gametes are being introduced, but here the zygote formed in the test tube, means in the laboratory having the suitable, providing the suitable environment as similar to the in vivo. The zygote which is formed by the test tube method is transferred into the fallopian tube by the help of laparoscopic surgery, as I have told you earlier. Okay, by the help of laparoscopic surgery, the zygote which is formed in the laboratory is being introduced into the fallopian tube where the further development occurs. Okay, so laparoscopic surgery where the further development takes place. Okay, gamete intrafallopian transfer means inside the fallopian transfer the gamete are being introduced where the fertilization takes place and also the further development up to the embryo and the fetus formation takes place. Whether in case of the zygote intrafallopian transfer, the zygote which is formed in the laboratory giving by the suitable environment is being introduced into the fallopian tube, by which the further development takes place and the formation of the fetus also takes place, and eventually the baby, the fully grown baby, is being developed inside the mother's womb. So these are your two more techniques of the ART, that are your gamete intrafallopian transfer and the zygote intrafallopian transfer, or GIFT or the ZIFT. Please note down. Next we will discuss our last two techniques, that are intracytoplasmic sperm injection and the surrogate mother. As the name suggests, intracytoplasmic sperm injection, intra means within, cytoplasmic means cytoplasm of the oocyte. Sperm injection means sperm is injected into the cytoplasm of the oocyte. So this method was first introduced by the Van Stratagem and his colleague in the year 1992 in Belgium. Okay, remind this point all. This was first introduced by Van Stratagem and his colleague in the year 1992 in Belgium. In this technique, what happens? One single spermatozoa, or we can say one single spermatid, is introduced or injected directly into the cytoplasm of the oocyte by a micropuncture of the zona pellucida. We know the oocyte is surrounded by the zona pellucida. By puncture or making a hole in the zona pellucida, the cytoplasm, inside the cytoplasm, the spermatid or spermatozoa, single spermatid, is introduced. Okay. What happened? This procedure is done under a high quality operating microscope. This all things are done. Obviously, spermatozoa and the egg and the spermatozoa is very small. Obviously, this should be done under a high quality microscope. How it is done? The one micropipette is used to hold the oocyte, and another micropipette, or we can say the injecting pipette, helps hold the spermatozoa. So in one micropipette it is holding the cytoplasm of the, or we can say it is holding the oocyte, and another injecting pipette helps in injecting the spermatozoa or the spermatid into the cytoplasm. Okay. So in this case, the fertilization efficiency process is about 60 to 70%, and the pregnancy rate is about 20 to 40%. Fertilization rate efficiency is about 60 to 70%, whereas the pregnancy rate is about 20 to 40%. Okay, so intracytoplasmic sperm injection means by the help of the micropipette which holds the oocyte, and the help of one injecting pipette, the spermatozoon or the spermatid is being introduced into the cytoplasm of the oocyte. Okay, where the fertilization takes place. And also the efficiency is about, the fertilization efficiency about 60 to 70%, and the pregnancy rate is about 20 to 40%. Last one is your surrogate mother. Surrogate mother means a woman who is not capable of developing embryo or a baby. So in that case, what happens? A nurse, another woman or another mother is being taken, another woman, we can say another woman is substituted in case of the real mother who nursed the embryo. Nurse means to develop or to grow the embryo. As the real mother is incapable, that is why another woman is substituted to develop the embryo. Next is a developing embryo is implanted into the uterus of another woman. As I said earlier, as the real mother is incapable, that is why the embryo is being implanted into the uterus of the another woman, where it can grow or develop easily. Lastly, the embryo transplants are more useful in case of surrogate mother. It is more useful in case of the animal. Perhaps it is done more in case of the animal, more in case of as compared to the human. For example, in case of the cow, buffalo, the embryo is being transplanted into the another mother. So it is mostly done in case of the animal, whether as compared to the humans. Okay. So in today's class we have discussed the infertility in women. Also we have discussed the ART, all the techniques of the ART, that is assisted reproductive technologies, in which 6 important techniques we have discussed, starting from the in vitro fertilization, IVF, and ends at the surrogate mother. Okay, so this is all about reproductive health. In the next class we'll start our new topic. So that's all for today. We'll meet in our next class. Thank you.